lecture.
Yay!
I'm really excited.
A tear.
Real excited.
She messed up.
That's right.
Oh, it's clipping your
All right. So abdomen. Abdomen is again one of those body parts or areas that's going to be very you're going to run into this most often. So they're chest X-ray, abdomen's the most common type of radiographs. So before we begin, just a general coverage on the anatomy. So the abdomen that we're talking about here, the anatomy located in the abdominal section includes the digestive tract or the alimentary canal. So we're talking about the distal esophagus, the stomach, the small intestine, the large bowel, and the other parts of the large bowel. The accessory organs associated with digestion includes the liver, the gallbladder, and the pancreas. Now, is this in your book? Okay. Again, one of those things, I find a lot of mistakes and a lot of errors, and that can be a lot of very confusing in what you're trying to study. The spleen is not part of the digestive system or the digestive tract. Okay, it is part of the immune system. Okay, I think they included it because it is located in the abdominal cavity, but don't confuse that as being part of the digestive tract or system. All right, it's part of the immune system. All right. The proximal section of the abdominal cavity, we have the stomach and we have the small intestines. The small intestines are broken up into 3 different sections. The most proximal is going to be the duodenum. It's going to be the shortest and the widest. The shortest and the widest. We will be spending a lot more time in the digestive tract next semester when I'll introduce you guys to the different types of fluoroscopic studies. So again, this is just going to be a scratch on the surface. This should be reviewed for you guys. All right, so the duodenum forms a C shape. It's going to be the shortest and the widest. The next segment here is 2/5 of the small intestine. That is the jejunum. And then the ileum is going to be the remaining 3/5 of the small intestine. So as it goes from proximal to distal, it goes from wide and short to a little bit smaller in diameter and lengthier. Okay? Now, you guys know the difference between the large intestine and the small intestine.
Mm-hmm.
As far as location. Small intestine is going to be centralized. Large intestine or bowel is going to be located in the periphery. Okay? So as long as you have that basic knowledge, when you are looking at a radiograph or an image that is filled with barium to study the digestive system, you have a better understanding of what those are. So here we have an upper GI in a small bowel series with the digestive tract filled with barium. Are you guys familiar with what barium is? Okay, barium is going to be one of the contrasts that we will use in visualizing the different structures. We use contrasts like iodine for vessels and barium for the digestive tract because it mimics that of bone. When you look at a radiograph, it's hard to distinguish the soft structures from the next, but obviously you can see the spine, you can see the ribs, you can see the pelvis, but everything in that cavity is hard to distinguish because they are so similar in the way it's made. So we introduce contrasts such as barium or iodine because it has a very high atomic number. It has the ability to absorb X-rays like bone. So when we fill those structures with contrast, it's white, just like bone.
For the small bowel, is it a swallow or is it enema?
For the small bowel, it's a swallow.
Okay.
So the upper GI and the proximal intestine, including the small intestine, is usually done with the ingestion of the barium. For lower GI, large colon, then it's the other way. All right, so here we have a small bowel study, also an upper GI study. with the patient swallowing the barium. And we have the different structures here. We have the stomach and we have the duodenum. And this area right here is the pyloric section. Again, we'll spend some more time on this next semester. The pyloric section of the stomach, pyloric bulb, which shows the beginning of the duodenal area. Do you say duodenum or duodenum?
Duodenum.
All right, your duodenum. And it has a C shape, and it's going to be the shortest portion. Okay. The next segment here is going to be, what's the next one?
The jejunum.
Jejunum. Okay. They're very easily identifiable if you know the characteristics of each of the sections. The duodenum is going to be short. It has a C shape to it. Okay. Next segment is the jejunum. The jejunum is going to be located more to the left side and a little bit towards the center. So here's the left and a little bit towards the center. Now, if you look at the appearances too, this is jejunum, this is ileum. Don't get it confused with your ileum or your iliac spine. It's a slightly nuanced in the way it's spelled. So this is spelled with an E, I-L-E-U-M, and your iliac is I-L-I, okay? So your jejunum versus your ileum. Do you notice that there is a difference in appearance?
Mm-hmm.
The jejunum has a feathery look, is what they say to it. It's feathery-like. It's also described as looking like stacked coins. But it is obvious that they do look very different. You guys agree?
Mm-hmm.
And when you look at the ileum, it starts to mimic that of the shape of the large bowel. They have little pockets throughout.
Isn't it the jejunum where most of the absorption takes place, right?
The jejunum?
Yeah.
Yes.
And that's where more fecal matter is being.
Yep.
In the ileum, right?
Right. And so again, it looks like the large bowel, but we know it's not the large bowel because the large bowel is going to be located out here. But it does look like large bowel.
Mhm.
But again, as long as you know the location of those different structures, you'll be able to tell the difference. All right, so let's go on the next one here. The large intestine. Large intestine, there's many parts to it. It's a simple structure, but there's a lot of parts to it. And I don't know why we're going this way. I think it's in alphabetical order. Yes? Let me see what I said. Yeah, that's kind of funny. They should have listed it as how the contents move. But I'll just do that here. I'm not going to look up here. I'm going to look over here. So from the ileum, the area between the small bowel and the large bowel is a junction, and the junction is this ileocecal valve. Which is in relation to the ileum and the cecal portion of the large bowel. This is the very start of the large bowel. And right off the cecum, you have the appendix. Nobody knows what the appendix is for, right? I guess at some point sometime there was some use for it, but now
It's just there to rupture and give you problems.
Exactly. And it does. It does
Yeah.
cause a lot of problems. It's there. They have no use for it, but it can cause a lot of problems, especially if you rupture it. Okay? So now from the cecum, we're going to go up the ascending colon. At the very top, where it's going to make an extreme left, is the right colic flexure, also known as the hepatic flexure. Right colic flexure or the hepatic flexure. Then it makes its way through the transverse colon. It's going to make another sharp turn. At this turn is the left colic or the splenic flexure. And it descends down to your descending colon. And then from there it takes a funny S-turn. In this area is called the sigmoid. The extension of the sigmoid is the rectum, and then lastly is the anus. I have my own way of saying it.
Last stop.
Yeah.
The
I can't say it
onions.
the other way, it makes me laugh. Okay, and this is where we get rid of all the excrements of digestion, okay? One thing that I want you guys to keep in mind is that when we are referring to the flexure here, the right colic or the hepatic flexure, this flexure is going to be a little bit lower than the one on the left, or the splenic flexure. Why is that?
Because of the liver?
Because of the liver, okay? The liver plays a role in the positioning of the inside anatomy. So the right colic flexure is going to be lower than the left. And then when we talk about the urinary system, the right kidney is going to be lower than the left because the liver pushes it down. All right? Any questions so far? We're going to be spending so much time on this next semester. It's not even funny. Okay?
Because of anus?
Anus.
Anus.
Studying that and
All right.
your anus.
Your accessory organs to digestion. So we have the liver. Liver is where what material is produced?
Bile.
Okay, it's bile. And what's the purpose of bile?
Fat.
Okay,
To-
so its main purpose, I mean, they have a lot of purposes,
break
but
down fats.
it breaks down or emulsifies fat. And the accessory organ within the liver is the gallbladder. And what's the purpose of the gallbladder?
Stores the bile.
Storage.
Stores the bile. Okay. Pancreas. Is that part of digestion?
Mm-hmm.
Okay, what does pancreas produce?
Insulin.
Insulin, okay, and enzymes, okay, but it is known for producing insulin, which controls
Blood sugar.
your blood sugar. Okay, controls your blood sugar. And then lastly, again, I don't know why they put this up here, is the spleen. I guess, again, I'm assuming it's because it's located in the abdomen, but again, not related to digestion. So the spleen filters your blood supply, and it produces
Red blood cells, right?
lymphocytes and leukocytes, and also stores different blood cells. All right, any questions here? Then we have CT images. When you're looking at the CT anatomy, it does help you understand the orientation and location of the different anatomical structures. So here we have the spleen, no, I'm sorry, the liver. Then you have the contrast-filled stomach. Right here in the middle is going to be your aorta, slightly lit up over here. Okay, this is the vena cava. Okay, aorta, vena cava, and then your spleen down here. Okay, more pictures of the anatomical structures in the abdomen. You guys can look through this on your own. Do you know that our school does offer cross-sectional anatomy?
Does it?
Yeah. So you guys can take that. Yeah. And I suggest that you take it because it will help you out in the field. And especially if you guys
Where do we-
want to learn about more about CT and MRI, when you do your rotations, it'll help you better understand what you guys are.
So how do we
doing.
do the hands-on stuff? Or because you don't have a CT machine. here,
Well,
right?
you.
You just study theory or what?
This is where we were talking about networking.
Uh-huh.
Remember networking? Did I ever talk about networking?
Yes.
Okay. Networking is just a clean word for brown nosing. Yeah,
Oh, okay.
exactly. Kissing butt. Okay?
Kissing the anus.
When you guys, as part of your clinical internship, you will have the opportunity to kind of rotate through the different departments to kind of help you steer you into a track that you may want to pursue in your future. One of those departments you will be observing is CT and also MRI, in addition to maybe special procedures, nuclear medicine, radiation therapy, possible PET scanning, but you will have an opportunity to see the different departments. So again, with that said, if you do have a chance, I highly suggest that you take a cross-sectional anatomy. I believe it's taught by Jack Griswold. You guys know Mr. Griswold?
Mr. CPR
That
man.
guy's funny. He's hilarious, okay. So he teaches the class, and I think it's just an 8-week or a 9-week course.
So you can just add it whenever you want?
You just do it on your time.
Okay.
Yeah, it's
Only
an
available
it's an
in fall,
elective.
though.
What's that?
It's only available in the fall.
Only available in the fall, yeah, but it's an elective. It's not part of the program, but you can take it. And you know, it gives you guys the advantage of when you guys are doing that rotation and you're observing, it'll go from observing to participating to actually maybe
Doing.
them allowing you to do the procedure yourself. I said this time and time and again, when you guys are doing your rotation, because there will be times, you're not gonna be always doing x-rays, there will be some downtime. Okay? There will be some downtime. So during that downtime, don't sit around, don't Facebook, don't Instagram, don't tweet, don't study. Go ask your supervisor, ask your CI, hey, you know what, is it okay if I go sit down, you know, help out CT? Is it okay if I go help out an MRI? Okay? Or I'll be like, I'll be in CT, you know where to find me. Once you get a little bit more comfortable with your department, okay? But that's the time you want to take advantage of that. Okay? So downtime, be productive. Okay, yes?
You said we were gonna have a CT rotation. Is that our first year in clinicals or
It's gonna
second?
be towards the end of the program.
Okay.
Yeah, so you'll spend, I believe, a week in each of the departments, and it's your choice. You have the option of doing that because, you know, if you're scheduled for a certain rotation in a department, you can say, yeah, you know what, I'm not even interested. You can do that, okay? But it is there for you guys. If you want to take advantage of it, that's up to you, you know, it's up to you. We can't force you to do that rotation. You know what I mean? Especially if you have no interest in it. But it's there for you guys if you do want to steer in that direction. I think also what they've done too is when you are doing your rotations, you can log in those exams that you've observed and it applies towards your licensing for that particular discipline.
Sweet.
Yeah, so it's not a waste of time. You actually are logging your procedures and that applies to, let's just say you saw 25 studies of CT. They count towards the examinations that is required for observation to take your CT examination. It counts towards it.
I had another question.
Yes.
In case we didn't have priority registration,
Mhm.
is there any way we could ask you and Ms. Mitz to save us a spot?
I don't see why not. I mean, I'm not gonna.
For this, you mean?
For cross-sectional anatomy?
Why is it usually a hard class to get into?
No,
I
I'm
didn't-
not sure.
I didn't even know we
I'm
had
just
it.
wondering.
Yeah, I don't think there's ever any issues about getting in.
Okay.
Yeah, as far as priority, I mean, if you guys are in the program, I mean, don't quote me on this, but I think you should have priority.
No, we don't, no.
Uh-uh.
No, I mean, not priority, but I mean, if you can't get in, that they will give you an ad code or
right.
something
Okay.
towards you, is what I'm saying. Yeah. Yeah, I can't control the priority registration, but I mean, they will take into account that you are a radiology student. Yeah. Okay. Sorry about getting sidetracked here. All right, the urinary system. The urinary system is comprised of 2 kidneys,
Bless you.
two ureters, 1 urinary bladder, and also the urethra. Again, if you notice the orientation here with the kidneys and the ureters, right kidney is going to be lower because of the liver. The ureter is also going to be smaller. It's going to be smaller than shorter than the one on the left. One of the accessory organs to the kidney is the adrenal gland. Again, the adrenal gland is, although it's located in the abdomen, it's not part of the urinary system. It is part of the endocrine system. And the adrenals produce certain types of chemicals that controls blood pressure, what else? Metabolism, stress.
Adrenaline.
What's that? What's that?
The absorption for water.
Yep, absorption of water, and some other things. That's just off the top of my head. Okay, any questions here? So the abdomen study can be done for a multitude of different things. Here we have what's known as an intravenous urogram. It can also be called an IVP, which stands for intravenous pyelogram. This requires the injection of iodinated contrast into a vein. So if we're injecting contrast through the vein, why are the kidneys lighting up?
Because they're vascular.
Okay.
They have blood vessels.
Yeah, because eventually the contrast is going to make its way to the kidneys, right? Because the kidneys is what filters the blood. So when you inject iodinated contrast into one of your vessels here in your arm, vein in specifically, not the artery, but the vein, it will eventually lead into the kidneys. And then it highlights the urinary system, including the collecting system of the kidneys. So here we have the left, here we have the right, you have the ureters, and then makes its way down here into where the bladder is. Eventually, you wait about 5 or 10 minutes, you will see the bladder being highlighted with the contrast agent.
What's C supposed to be doing?
What C is, B and C, they're both ureters. One is proximal, the other one is distal. And then D, I don't know, D is kind of a funky place, but they're showing the outline of the kidney.
Maybe they're
The renal
putting an
parenchyma.
adrenal gland?
What's that?
What if it's an adrenal gland on top of the kidney? You can't see it.
You know, you
but I
can't see
don't
the
know if it's
adrenals.
just
You can't
showing
see it on X-ray.
Okay.
Yeah. You can see it in CT, which is actually, you can see in CT and you can also see it in ultrasound, but you can't see it on a plain image like this. All right, take the class, guys. Yeah. It looks like a bunch of garbage, but. So here we have one of the lumbars. You got the back muscles, psoas muscles. The psoas muscle is a muscle that you can't see radiographically on plain film. We'll talk about this in just a little bit. And you have the right kidney, left kidney, the ureters coming from the kidneys. What else do we have here?
K and L are the
aorta,
vessels.
Vena cava. What's that?
I said K and L are the vessels, right? The great vessels.
K and L are, yeah, so these are your great vessels. K is your aorta, vena cava is on the left. So again, if you know your anatomy, they're large vessels. Aorta is on the left, just like the heart. Vena cava on the right. Then we have a little bit small here, so I'm going to say these are your small intestines. Small intestine, large bowel, liver, more large bowel. Yeah, it's if you have the opportunity of taking that class, it's really helpful. Okay, so we'll get into the different structures located in the abdominal cavity. Another rundown. So here's a cross section. The cavity, the wall, as well as the organs located in the abdomen, a majority of them are covered with a fluid-like sac. A serous membrane is what they call it because it's see-through, very lubricious. It's the protective coating. The coating itself, just like the lungs, has it's double-walled. The outer is going to be the parietal peritoneum. The inside is going to be the visceral peritoneum. And then within those two walls is the pleural cavity. Okay? So again, most of the wall and the organs are lined with this peritoneum.
Pleural or peritoneal cavity?
Plural applies to the lungs.
You said peritoneal. You said pleural cavity.
I thought I said peritoneal. Did I say
No,
plural?
you said plural.
Okay, my bad.
Okay.
Thank you. Peritoneal cavity. All right. Within the abdomen, the peritoneum, again, the double-walled peritoneum, which covers the walls and some of the organs, they have certain names depending on what their function is within the abdomen. So we have all these, we have the membranes, they're folded into all different directions. And one of the purpose of this peritoneum is it attaches all these different organs into the abdominal wall and other organs. So that way it doesn't move around, it's actually attached to something. That will allow you to move around, jump around, and your organs stay in place. So that's one of the purpose of the peritoneum. The first one here, the first part is what's known as the omentum. The omentum is the peritoneum. The omentum attaches the stomach to other abdominal organs. The omentum attaches the stomach to other abdominal organs. So this applies more to the stomach. It has a greater omentum, and it has a lesser omentum. The greater omentum extends from the greater curvature, that's GC, the greater curvature of the stomach. The stomach has two curves. Okay, it has an inside curve, it has an outside curve. The outside curve is the greater curvature. So the greater extends from the greater curvature of the stomach over the small intestines and folds back on itself, back to the transverse colon, and then back to the abdominal wall. The lesser hangs down from the liver and to the lesser curvature of the stomach. Are you guys understanding the difference between the greater and the lesser? So I may have to draw this. Are you all familiar with at least the basic anatomy of the stomach and how it looks? So here's your esophagus, okay, and then your stomach. Looks something like that. This is your greater curvature. The inside is your lesser curvature. All right. Now the mesentery, also the peritoneum, is double folded. The mesentery attaches the stomach, the small intestine, the pancreas, spleen, and other organs to the posterior wall of the abdomen. And then the mesocolon attaches the colon to the dorsal, again, the backside of the abdominal wall. Questions so far? Just cut out of the, what do we have here, the mesocolon. The mesocolon is again the one responsible for attaching the large colon to the posterior wall. You have a greater omentum, draws up over the chest. Let's go ahead and talk about the different structures located. I'm going to skip, do I need to skip this? Yeah, I'm going to skip this, okay, because there's some more in greater detail here. Okay, so the peritoneum again is what covers a majority. It doesn't cover everything. It covers a majority of the organs and a majority of the wall in the abdominal cavity. So those that are covered by the peritoneum, structures that are found within the peritoneum are your infraperitoneal organs. So for the purpose of demonstration, showing the rest of the anatomy, so within the peritoneum you have the liver, gallbladder, spleen, stomach, jejunum, ileum, cecum, and the transverse and sigmoid colon. In the back of the peritoneum is where you're going to find the vena cava, inferior vena cava, the right adrenal gland and the right kidney, the duodenum, pancreas, ascending colon, descending colon, the aorta, and the ureter. And then below the peritoneum, the infraperitoneal structures, you'll find the lower rectum and the bladder and male reproductive organs.
So there's like 3 bags inside the abdomen?
It's one bag.
One bag?
Yeah,
Just-
one bag.
just different
Yeah.
sections everywhere.
So what's in the bag or the sac is your infraperitoneal structures. This is in the bag, the encasing.
It's just
What
like
about what?
layers.
Yeah, so if you go back over here, this area is showing you the sac that lines up the abdominal cavity. So whatever's in here is infraperitoneal. Whatever in the back, what color is this, by the way?
Purple.
Purple, okay. So anything in purple are your structures in the peritoneum. Okay, so anything purple is in. Behind it is your retroperitoneal structures, and then below the purple is your infraperitoneal structures. So again, the sac is there, but it doesn't cover everything, but most of it.
So what happened to the left kidney? and-
That's my question too.
I don't know, it's the
It's there,
stepchild.
they're both there,
It's a
right though?
stepchild?
Yeah, it's a stepchild. The left kidney, that's a good question. It should be.
They're both in the retroperitoneum, aren't they? Or
Well, no, it should be retroperitoneal.
You
Oh,
got-
I know what's happening. It's not showing because of the superposition of the different anatomical structures. So it's still located in there. Yeah. They just didn't include it because of the other structures that are superimposed to it. Okay. Quadrants. We use quadrants in regions to describe the location of the different anatomical structures. We use it especially when we are getting a history on our patient. So when you're asking your patient, okay, Ms. Smith, why are you here? What kind of problems are you having? Where does it hurt? Can you point to it? So to help the doctors out, if they say I hurt here, you would write on your requisition or history, patient is complaining of pain in the right upper quadrant. Patient is complaining of pain in the left lower quadrant. So that's generally how we describe the description in the location of pain or the area of interest when we are writing our patient history. So it's broken down to 4 quadrants. I highly suggest that you know where the structures are in relation to the quadrants. So here, right upper quadrant, you'll find a majority of the liver, the distal part of the stomach, the distal part of the pancreas, and then the duodenum. On the left upper quadrant, you have a majority of the stomach, the spleen, the head of the pancreas. You'll have also here the left colic flexure, the small bowel, and then right down here, ascending, part of transverse. Over here, part of transverse, descending, and then the sigmoid rectal area. Now, this is just a general mapping because it changes with body habitus. So this is just a general map. Boy, what's all this? Okay. Or it can be broken down to 9 different regions.